A nurse observes a patient rising from a chair slowly by pushing on the chair arms. Which type of tension and contraction did the nurse observe? A. Eccentric tension and isotonic contraction. B. Eccentric tension and isometric contraction. C. Concentric tension and isotonic contraction. D. Concentric tension and isometric contraction. Answer A. Eccentric tension and isotonic contraction. Rationale: this movement causes eccentric tension and isotonic contraction. Eccentric tension helps control the speed and direction of movement. For example, when using an overhead trapeze, the patient slowly lowers himself to the bed. The lowering is controlled when the antagonistic muscles lengthen. By pushing on the chair arms and rising, eccentric tension and isotonic contraction occurred. In concentric tension, increased muscle contraction causes muscle shortening, resulting in movements such as when a patient uses an overhead trapeze to pull up in bed. Concentric and eccentric muscle actions are necessary for active movement and therefore are referred to as dynamic or isotonic contraction. Isometric contraction, static contraction, causes an increase in muscle tension or muscle work but no shortening or active movement of the muscle, e.g. instructing the patient to tighten and relax a muscle group, as in quadriceps set exercises or pelvic floor exercises. The nurse is providing care to a patient who is bedridden. The nurse raises the height of the bed. What is the rationale for the nurse's action? A. Narrows the nurse's base of support. B. Allows the nurse to bring feet closer together. C. Prevents a shift in the nurse's base of support. D. Shifts the nurse's center of gravity farther away from the base of support. Answer: C. Prevents a shift in the nurse's base of support. Rationale: raising the height of the bed when performing a procedure prevents bending too far at the waist and shifting the base of support. Balance is maintained by proper body alignment and posture through two simple techniques. First, widen the base of support by separating the feet to a comfortable distance. Second, increase balance by bringing the center of gravity closer to the base of support. The nurse is caring for a patient with inner ear problems. Which goal is the priority? A. Maintain balance. B. Maintain proprioception. C. Maintain muscle strength. D. Maintain body alignment. Answer: A. Maintain balance. Rationale: with the inner ear, the semicircular canals, three fluid-filled structures that help maintain balance. Proprioception is the awareness of the position of the body and its parts, and proprioceptors are located on nerve endings, not the inner ear. Muscle strength is maintained with activity and exercise. Although body alignment is important, it is not maintained by the inner ear. A patient with diabetes mellitus is starting an exercise program. Which types of exercises will the nurse suggest? A. Low intensity. B. Low to moderate intensity. C. Moderate to high intensity. D. High intensity. Answer: B. Low to moderate intensity. Rationale: instruct patients diagnosed with diabetes mellitus to perform low to moderate intensity exercises. Carry a concentrated form of carbohydrates, sugar packets or hard candy, and wear a medical alert bracelet. Low intensity is not beneficial. Moderate to high and high intensity are not recommended for a beginner exercise program. The nurse is developing a plan of care for a patient diagnosed with activity intolerance. Which strategy will the nurse use to provide the best chance of maintaining patient compliance? A. Performing 20 minutes of aerobic exercise 7 days a week with 10-minute warm-up and cool-down periods. B. Instructing the patient to use an exercise log to record day, time, duration, and responses to exercise activity. C. Stressing the harm of not exercising by getting the patient to take responsibility for current health status. D. Arranging for the patient to join a gym that takes self-pay rather than insurance. Answer B. Instructing the patient to use an exercise log to record day, time, duration, and responses to exercise activity. Rationale: keeping a log may increase adherence to an exercise prescription. Recommended frequency of aerobic exercise is 3 to 5 times per week or every other day for approximately 30 minutes. Focusing on the harm of not exercising is usually counterproductive. Instead, the nurse should instruct the patient about the physiological benefits of a regular exercise program. Developing a plan of exercise that the patient may perform at home may improve compliance. The nurse is preparing to transfer an incooperative patient who does not have upper body strength. Which piece of equipment will be best for the nurses to obtain? A. Draw sheet. B. Full body sling. C. Overhead trapeze. D. Friction reducing sled sheet. Answer B. Full body sling. Rationale: using a mechanical lift and full body sling to transfer an incooperative patient who can bear partial weight or a patient who cannot bear weight and is either incooperative or does not have upper body strength to move from bed to chair prevents musculoskeletal injuries to healthcare workers. The nurse should not attempt to move the patient with a draw sheet. The patient does not have upper body strength, so an overhead trapeze is not appropriate. A friction-reducing slide sheet that minimizes shearing forces is not as effective as a full body sling. The nurse is teaching a patient how to sit with crutches. In which order will the nurse present the instructions, starting with the first step? 1. Place both crutches in one hand. 2. Grasp arm of chair with free hand. 3. Completely lower self into chair. 4. Transfer weight to crutches and unaffected leg. Answer 1. Place both crutches in one hand. 4. Transfer weight to crutches and unaffected leg. 2. Grasp arm of chair with free hand. 3. Completely lower self into chair. Rationale: a patient is sitting in a chair with crutches. Both crutches are held in one hand. The patient then transfers weight to the crutches and the unaffected leg. Next, the patient grasps the arm of the chair with the free hand and begins to lower self into chair. Finally, the patient completely lowers self into chair. The nurse is caring for a group of patients. Which patient will the nurse see first? A. A patient with chronic obstructive pulmonary disease doing stretching exercises. B. A patient with diabetes mellitus carrying hard candy while doing exercises. C. A patient with a heart attack doing isometric exercises. D. A patient with hypertension doing Tai Chi exercises. Answer C. A patient with a heart attack doing isometric exercises. Rationale: the nurse must see the myocardial infarction patient first to stop this type of exercise. It is important to understand the energy expenditure, increased respiratory rate, and increased work on the heart associated with isometric exercises because the exercises are sometimes contraindicated in certain patients' illnesses, e.g., myocardial infarction or chronic obstructive pulmonary disease. All the rest are appropriate. Stretching exercises are beneficial for patients with chronic obstructive pulmonary disease. Also instruct patients to perform low to moderate intensity exercises, carry a concentrated form of carbohydrates, sugar packets or hard candy, and wear a medical alert bracelet. The effect of a Tai Chi exercise program has demonstrated a significant reduction in systolic and diastolic blood pressures. A 55-year-old patient is preparing to start an exercise program. The healthcare provider wants 60% of maximum target heart rate. Calculate the heart rate that the nurse will add to the care plan as the target heart rate. Record answer as a whole number. Blank. Maximum heart rate 1. 82. 99 3. 110 4. 75. Answer 2. 99. Rationale. Teach patients to calculate their maximum heart rate by subtracting their current age in years from 220 and then obtaining their target heart rate by taking 60% to 90% of the maximum. Depending on their healthcare provider's recommendation, 220 minus 55 equals 165 times 0.6 equals 99. A patient is admitted with a stroke. The outcome of this disorder is uncertain, but the patient is unable to move the right arm and leg. The nurse starts passive range of motion (ROM) exercises. Which finding indicates successful goal achievement? A. Heart rate decreased. B. Contractures developed. C. Muscle strength improved. D. Joint mobility maintained. Answer D. Joint mobility maintained. Rationale: when patients cannot participate in active ROM, maintain joint mobility and prevent contractures by implementing passive ROM into the plan of care. Exercise and active ROM can improve muscle strength. ROM is not performed for the heart but for the joints. A nurse is teaching a health promotion class about isotonic exercises. Which types of exercises will the nurse give as examples? A. Swimming, jogging, and bicycling. B. Tightening or tensing of muscles without moving body parts. C. Quadriceps set exercises and contraction of the gluteal muscles. D. Push-ups, hip lifting, pushing feet against a footboard on the bed. Answer A. Swimming, jogging, and bicycling. Rationale: examples of isotonic exercises are walking, swimming, dance aerobics, jogging, bicycling, and moving arms and legs with light resistance. Isometric exercises involve tightening or tensing of muscles without moving body parts. Examples include quadriceps set exercises and contraction of the gluteal muscles. Examples of resistive isometric exercises are push-ups and hip lifting, as well as placing a footboard on the foot of the bed for patients to push against with their feet. An adolescent tells the nurse that a health professional said the fibrous tissue that connects bone and cartilage was strained in a sporting accident. On which structure will the nurse focus an assessment? A. Tendon. B. Ligament. C. Synergistic muscle. D. Antagonistic muscle. Answer B. Ligament. Rationale: ligaments are white, shiny, and flexible bands of fibrous tissue that bind joints and connect bones and cartilage. Tendons are strong, flexible, and inelastic as they serve to connect muscle to bone. Muscles attach bone to bone. Synergistic muscles contract to accomplish the same movement. Antagonistic muscles cause movement at the joint. The nurse gives instructions to a nursing assistive personnel (NAP) regarding exercise for a patient. Which action by the NAP indicates a correct understanding of the directions? A. Determines the patient's ability to exercise. B. Teaches the patient how to do the exercises. C. Reports the patient got dizzy after exercising. D. Advises the patient to work through the pain. Answer C. Reports the patient got dizzy after exercising. Rationale: the NAP notifies the nurse if the patient reports increased fatigue, dizziness, or lightheadedness when obtaining pre-exercise and/or post-exercise vital signs. The nurse first must assess the patient's ability and tolerance to exercise. The nurse also teaches patients and their families how to implement exercise programs. The NAP can prepare patients for exercise, e.g., putting on shoes and clothing, providing hygiene needs, and obtaining pre-exercise and post-exercise vital signs. The NAP can help the patient exercise. A nurse is assisting the patient to perform isometric exercises. Which action will the nurse take? A. Encourage wearing tight shoes. B. Set the pace for the exercise session. C. Stop the exercise if pain is experienced. D. Force muscles or joints to go just beyond resistance. Answer C. Stop the exercise if pain is experienced. Rationale: instruct the patient to stop the activity if pain, fatigue, or discomfort is experienced. Assess for pain, shortness of breath, or a change in vital signs. If present, stop the exercise. Let each patient move at his or her own pace. Assess for joint limitations, and do not force a muscle or a joint during exercise. Teach patient to wear comfortable shoes and clothing for exercise. The nurse is starting an exercise program in a local community as a health promotion project. Which information will the nurse include in the teaching session? A. A cool-down period lasts about 5 to 10 minutes. B. The purpose of weight training is to bulk up muscles. C. Resistance training is appropriate for warm-up and cool-down periods. D. Aerobic exercise should be done 3 to 5 times per week for about 20 minutes. Answer A. A cool-down period lasts about 5 to 10 minutes. Rationale: the cool-down period follows the exercise routine and usually lasts about 5 to 10 minutes. The purposes of weight training from a health perspective are to develop tone and strengthen to simulate and maintain healthy bone. Stretching and flexibility exercises are ideal for warm-up and cool-down periods. The recommended frequency of aerobic exercise is 3 to 5 times per week or every other day for approximately 30 minutes. The patient is eager to begin an exercise program with a 2-mile jog. The nurse instructs the patient to warm up. The patient does not want to waste time with a warm-up. Which information will the nurse share with the patient? A. The warm-up in this case can be done after the 2-mile jog. B. The warm-up prepares the body and decreases the potential for injury. C. The warm-up allows the body to readjust gradually to baseline functioning. D. The warm-up should be performed with high intensity to prepare for the coming challenge. Answer B. The warm-up prepares the body and decreases the potential for injury. Rationale: the warm-up activity prepares the body for activity and decreases the potential for injury and should not be omitted. It usually lasts about 5 to 10 minutes and may include stretching, calisthenics, and/or aerobic activity performed at a lower intensity. The warm-up is before the exercise while the cool-down period is after the exercise. The cool-down, not the warm-up, allows the body to readjust gradually to baseline functioning and provides an opportunity to combine movements such as stretching with relaxation, enhancing mind-body awareness. The warm-up should not be a high-intensity workout. The nurse is teaching a patient how to use a cane. Which information will the nurse include in the teaching session? A. Place the cane at the top of the hip bone. B. Place the cane on the stronger side of the body. C. Place the cane in front of the body and then move the good leg. D. Place the cane 10 to 15 inches in front of the body when walking. Answer B. Place the cane on the stronger side of the body. Rationale: have the patient keep the cane on the stronger side of the body. A person's cane length is equal to the distance between the greater trochanter and the floor. The cane should be moved first and then the weaker leg, for maximum support when walking. The patient places the cane forward 15 to 25 centimeters, 6 to 10 inches, keeping body weight on both legs. The weaker leg is then moved forward to the cane, so body weight is divided between the cane and the stronger leg. The nurse is caring for a patient who cannot bear weight but needs to be transferred from the bed to a chair. The nurse decides to use a transportable hydraulic lift. What will the nurse do? A. Place a horseshoe-shaped base on the opposite side from the chair. B. Remove straps before lowering the patient to the chair. C. Hook longer straps to the bottom of the sling. D. Attach short straps to the bottom of the sling. Answer C. Hook longer straps to the bottom of the sling. Rationale: the nurse should attach the hooks on the strap to the holes in the sling. Short straps hook to top holes of the sling. Longer straps hook to the bottom of the sling. The horseshoe-shaped base goes under the side of the bed on the side with the chair. Position the patient and lower slowly into the chair in accordance with manufacturer guidelines to safely guide the patient into the back of the chair as the seat descends. Then remove the straps and the mechanical, hydraulic lift. The nurse is preparing to move a patient to a wheelchair. Which action indicates the nurse is following recommendations for safe patient handling? A. Mentally reviews the transfer steps before beginning. B. Uses own strength to transfer the patient. C. Focuses solely on body mechanics. D. Bases decisions on intuition. Answer A. Mentally reviews the transfer steps before beginning. Rationale: safe patient handling includes mentally reviewing the transfer steps before beginning the procedure to ensure both the patient's and your safety. Use the patient's strength when lifting, transferring, or moving when possible. Body mechanics alone do not protect the nurse from injury to the musculoskeletal system when moving, lifting, or transferring patients. After completing the assessment, nurses use an algorithm to guide decisions about safe patient handling. A nurse is working in a facility that follows a comprehensive safe patient handling program. Which finding will alert the nurse to intervene? A. Mechanical lifts are in a locked closet. B. Algorithms for patient handling are available. C. Ergonomic assessment protocols are being followed. D. A no-lift policy is in place with adherence by all staff. Answer A. Mechanical lifts are in a locked closet. Rationale: the nurse will follow up when lifts are not kept in convenient locations. Comprehensive safe patient handling programs include the following elements: an ergonomics assessment protocol for healthcare environments, patient assessment criteria, algorithms for patient handling and movement, special equipment kept in convenient locations to help transfer patients back, injury resource nurses. An after-action review that allows the healthcare team to apply knowledge about moving patients safely in different settings, and a no-lift policy. A nurse is following the no-lift policy when working to prevent personal injury. Which type of personal back injury is the nurse most likely trying to prevent? A. Thoracic. B. Cervical. C. Lumbar. D. Sacral. Answer C. Lumbar. Rationale: the most common back injury for nurses is strain on the lumbar muscle group, which includes the muscles around the lumbar vertebrae. While cervical, thoracic, and sacral can occur, lumbar is the most common. The nurse is caring for a patient in the emergency department with an injured shoulder. Which type of joint will the nurse assess? A. Fibrous. B. Synovial. C. Synergistic. D. Cartilaginous. Answer B. Synovial. Rationale: synovial joints, or true joints, such as the hinge type at the elbow, are freely movable and the most mobile, numerous, and anatomically complex body joints. Fibrous joints fit closely together and are fixed, permitting little, if any, movement, such as the syndesmosis between the tibia and the fibula. Synergistic is a type of muscle, not joint. Cartilaginous joints have little movement but are elastic and use cartilage to unite separate bony surfaces, such as the syngandrosis that attaches the ribs to the costal cartilage. A nurse notices that a patient has a structural curvature of the spine associated with vertebral rotation. Which condition will the nurse most likely find documented in the patient's medical record? A. Scoliosis. B. Arthritis. C. Osteomalacia. D. Osteogenesis. Answer A. Scoliosis. Rationale: scoliosis is a structural curvature of the spine associated with vertebral rotation. Osteogenesis imperfecta is an inherited disorder that makes bones porous, short, bowed, and deformed. Osteomalacia is an uncommon metabolic disease characterized by inadequate and delayed mineralization, resulting in compact and spongy bone. Arthritis is an inflammatory joint disease characterized by inflammation or destruction of the synovial membrane and articular cartilage and by systemic signs of inflammation. Which is a congenital defect? 1. Arthritis. 2. Scoliosis. 3. Osteoporosis. 4. Osteomalacia. Answer 2. Scoliosis. Rationale: scoliosis is a structural curvature of the spine associated with vertebral rotation. It is a congenital defect. Arthritis is an inflammatory joint disease that causes systemic signs of inflammation and destruction of the synovial membrane and articular cartilage. Osteoporosis is an aging disorder that results in the reduction of bone density or mass. Osteomalacia is an uncommon metabolic disease characterized by inadequate and delayed mineralization, resulting in compact and spongy bones. How is the isotonic form of exercise different from the isometric form? 1. Isotonic exercises promote osteoblastic activity. 2. Isotonic exercises enhance circulatory functioning. 3. Isotonic exercises increase muscle mass, tone, and strength. 4. Isotonic exercises cause muscle contraction and changes in muscle length. Answer 4. Isotonic exercises cause muscle contraction and changes in muscle length. Rationale: isotonic exercises cause muscle contraction and changes in muscle length, whereas isometric exercise involves tightening or tensing muscles without moving the body parts. Both isotonic and isometric forms of exercise promote osteoblastic activity. Both forms of exercise enhance circulatory functioning. Both forms of exercise increase muscle mass, tone, and strength. A patient with type 1 diabetes mellitus had normal blood glucose levels before going to the gym. While performing strenuous exercise at the gym, the patient suddenly collapsed. What is the most probable reason for this? 1. Low blood pressure. 2. Low blood sugar. 3. Vasovagal syncope. 4. High blood sugar. Answer 2. Low blood sugar. Rationale: exercise tends to decrease sugar levels and the patient is most likely to have low blood sugar or hypoglycemia. A patient with type 1 diabetes mellitus should perform low to moderate intensity exercises and carry a hard candy or sugar packets. The patient should also be informed to wear an alert bracelet. According to the scenario, the patient does not present with blood pressure-related problems, thus it is highly unlikely for hypotension or vasovagal syncope to be present in this patient. Hyperglycemia or high blood sugar would not cause a sudden collapse. Which is the correct gait when a patient is ascending stairs on crutches? 1. The affected leg is advanced between the crutches to the stairs in a modified 2-point gait. 2. The unaffected leg is advanced between the crutches to the stairs in a modified 3-point gait. 3. A swing through gait. 4. Both legs advance between the crutches to the stairs in a modified 4-point gait. Answer 2. The unaffected leg is advanced between the crutches to the stairs in a modified 3-point gait. Rationale: when ascending stairs on crutches, the patient usually uses a modified 3-point gait. The nurse is caring for a patient who has a lack of coordination and weakness of both lower limbs. The patient is able to bear weight on both limbs but is unable to walk independently. Which gait does the nurse teach the patient? 1. A 2-point gait. 2. A 4-point gait. 3. A 3-point gait. 4. A 3-point alternating gait. Answer 2. A 4-point gait. Rationale: in a 4-point gait, the patient bears his or her weight on both legs, which provides stability when walking. The patient then moves each leg alternately with each opposing crutch. The patient is able to bear weight but is unable to walk independently. Thus, the nurse should teach the 4-point gait to the patient. This gait helps in maintaining stability while walking. Once the patient has mastered the 4-point gait pattern, the patient should be taught the 2-point gait, wherein the patient moves the crutch and opposing leg at the same time. In a 3-point or 3-point alternating gait, the patient bears the weight on both crutches first and then on the uninvolved leg alternately. This gait pattern is taught to those patients who lack function of one limb. Which actions are appropriate for the nurse to implement when a patient experiences orthostatic hypotension? Select all that apply. 1. Call for assistance. 2. Allow patient to sit down. 3. Take patient's blood pressure and pulse. 4. Continue to ambulate patient to build endurance. 5. If patient begins to faint, allow him or her to slide against the nurse's leg to the floor. Answer 1. Call for assistance. 2. Allow patient to sit down. 3. Take patient's blood pressure and pulse. 5. If patient begins to faint, allow him or her to slide against the nurse's leg to the floor. Rationale: if the patient complains of dizziness and/or lightheadedness upon standing, call for assistance and allow the patient to sit back down. If the patient has a fainting episode, syncope, assume a wide base of support with one foot in front of the other, thus supporting the patient's body weight. Extend one leg and let the patient slide against it. Gently lower the patient to the floor, protecting his or her head. Take the patient's blood pressure and pulse as soon as possible after the incident. Continuing to ambulate the patient in this condition is unsafe and can result in a fall or other injury. It will not help improve the patient's endurance. Before discharge of a bedridden patient to home, the nurse taught the patient's caregiver about repositioning the patient every 2 hours to prevent development of pressure ulcers. 4 days after discharge, the patient developed skin breakdown at the sacral region with redness and edema. What does the nurse say in order to evaluate the caregiver's understanding of the repositioning techniques taught during discharge? 1. I suspect the patient is developing pressure ulcers. 2. You have been careless in not following my instructions. 3. I shall refer the patient to the primary health care provider for an antibiotic prescription. 4. Have you been repositioning the patient every 2 hours? Answer 4. Have you been repositioning the patient every 2 hours? Rationale. When evaluating the nursing interventions, the nurse should compare the actual outcomes with the expected outcomes. If the expected outcomes are not met, the nurse should try to explore the reason behind it and make changes in the teaching strategy. Therefore, the most important step would be to ask for the reason behind the development of pressure ulcers and if the caregiver had been following the repositioning regimen. Stating that the patient may have developed pressure ulcers may not help in evaluating the nursing intervention. When talking to the patient, the nurse should avoid judgments or use demeaning words such as careless. Referring the patient to a primary health care provider would be helpful in obtaining a prescription for antibiotics, but would not help in evaluating the nursing interventions. How is the body alignment and posture of a patient in a standing position different from the body alignment and posture of a patient in a sitting position? 1. The head is erect. 2. The spine is straight. 3. The arms hang at the sides. 4. The feet are flat on the floor. Answer 3. The arms hang at the sides. Rationale. In a standing position, the arms of the patient hang comfortably at the sides. In a sitting position, the forearms of the patient are supported on the arm rest in the lap or on a table in front of the chair. In both the positions, the head is erect, the spine is straight, and the feet are flat on the floor. While the nurse is talking to a patient, the patient faints and starts to fall. Arrange the steps the nurse takes in the appropriate order to protect the patient from head injury. 1. Extend one leg and let the patient slide down against the leg. 2. Assume the wide base of support. 3. Gently lower the patient to the floor, protecting the head. 4. Put one foot in front of the other to support the patient's body weight. Answer 2. Assume the wide base of support. 4. Put one foot in front of the other to support the patient's body weight. 1. Extend one leg and let the patient slide down against the leg. 3. Gently lower the patient to the floor, protecting the head. Rationale. When the nurse finds that a patient is having a fainting episode and is about to fall, it is important to protect the patient from head injury. The first step by the nurse should be to assume a wide base of support by having one foot in front of the other to support the patient's body weight. The nurse should then extend one leg and let the patient slide down against this leg. The final step is to gently lower the patient to the floor, protecting the head. The nurse is teaching a 4-point alternating gait to a patient. If the patient has understood the teaching completely, what will be the pattern of the patient's gait? 1. The patient will advance both the left crutch and right foot at the same time. 2. The patient will advance both the right crutch and left foot at the same time. 3. The patient will move the right crutch forward first and then the left foot forward. 4. The patient will move the right leg forward first and then the right crutch forward. Answer 3. The patient will move the right crutch forward first and then the left foot forward. Rationale. In a 4-point alternating or 4-point gait, the patient bears the weight on both legs to provide stability. In this gait, once a crutch is moved and again bearing weight, the opposite leg is then moved so that at all times there are 3 points of support on the floor. Therefore, the most appropriate pattern would be to move the right crutch first and then the left foot. Moving the opposite crutch and foot, such as left foot and right crutch, at the same time describes the 2-point gait. Moving the right leg forward first and then the right crutch forward won't provide support. The nurse is attending to an older adult patient. The nurse understands that the patient is at risk of osteoarthritis due to advanced age. What questions should the nurse ask the patient to assess the osteoarthritis? Select all that apply. 1. Do you feel pain in the legs when climbing stairs? 2. Do you have pain in your knee or back when you walk? 3. Do you consume fruits daily? If yes, which fruits? 4. Are you able to go for morning walks even with the pain and discomfort? 5. Do you void regularly? Is there any difficulty in defecation? Answer. 1. Do you feel pain in the legs when climbing stairs? 2. Do you have pain in your knee or back when you walk? 4. Are you able to go for morning walks even with the pain and discomfort? Rationale. Assessment questions for osteoarthritis include asking about mobility, endurance, and pain. Bowel and bladder elimination is not directly related to osteoarthritis. Eating fruit in the diet is not directly related to osteoarthritis. How does the nurse move his or her own body while transferring a patient to a bed? 1. The nurse relaxes the abdominal muscles. 2. The nurse twists the back and the pelvis slightly. 3. The nurse keeps the feet wide apart and bends at the knees. 4. The nurse avoids asking the patient to help as much as possible. Answer. 3. The nurse keeps the feet wide apart and bends at the knees. Rationale. The nurse keeps the feet wide apart and bends at knees to get a broader base of support, which increases stability and maintains a center of gravity. The nurse should tighten, not relax, the abdominal muscles to reduce the risk of injury to the lumbar vertebrae and muscle groups. The nurse avoids twisting and keeps the back, neck, pelvis, and feet aligned to decrease the risk of injury. The nurse encourages the patient to help as much as possible to promote patient independence and strength while minimizing the nurse's workload. The nurse measures the distance between the greater trochanter muscle of the patient and the floor and finds it to be 3 feet. How long should the patient's cane be? 1, 2 feet, 2, 3 feet, 3, 4 feet, 4, 5 feet. Answer. 2, 3 feet. Rationale. The patient's cane length should be 3 feet because a patient's cane length should be equal to the distance between the greater trochanter muscle and the floor. A 2FT cane is too short and a cane that is 4 feet or 5 feet is too long. What nursing intervention should the nurse provide to a patient who has impaired gas exchange related to decreased cardiac output? 1. Teach the patient how to restrict fluid intake. 2. Administer oxygen at 2 L per minute via the nasal cannula. 3. Record activity of the patient in an exercise log daily along with the response. 4. Ask the patient to perform a 2 to 3 mile brisk walk and isometric exercises 3 to 4 times a week. Answer. 2. Administer oxygen at 2 L per minute via the nasal cannula. Rationale. A patient should be administered oxygen at a rate of 2 L per minute via the nasal cannula if the patient has impaired gas exchange related to decreased cardiac output. A patient who is diagnosed with decreased cardiac output related to decreased myocardial contractility should be taught how to restrict the intake of fluids. The nurse should record the activity of the patient in exercise log daily along with the response in case of activity intolerance related to physical deconditioning. The nurse should guide a patient who is diagnosed with activity intolerance related to physical deconditioning to take brisk walks and perform isometric exercise 3 to 4 times a week. The patient reports being tired and weak and lacks energy. Upon assessment, the nurse finds that patient has gained weight and blood pressure and pulse are elevated after climbing stairs. Which nursing diagnosis will the nurse add to the care plan? A. Fatigue. B. Ineffective coping. C. Activity intolerance. D. Decreased cardiac output. Answer C. Activity intolerance rationale. You consider nursing diagnoses of activity intolerance or fatigue in a patient who reports being tired and weak. Further review of assessed defining characteristics, e.g., abnormal heart rate and verbal report of weakness, and the assessment findings occurring during the activity of climbing the stairs leads to the definitive diagnosis, activity intolerance. There is no data to support ineffective coping or decreased cardiac output. The patient weighs 450 pounds, 204.5 kilograms, and reports shortness of breath with any exertion. The healthcare provider has recommended beginning an exercise program. The patient states that she can hardly get out of bed and just cannot do anything around the house. Which nursing diagnosis will the nurse add to the care plan? A. Activity intolerance related to excessive weight. B. Impaired physical mobility related to bed rest. C. Unbalanced nutrition, less than body requirements. D. Impaired gas exchange related to shortness of breath. Answer A. Activity intolerance related to excessive weight rationale. In this case, activity intolerance is related to the patient's excessive weight. The patient is not on bed rest, although claims that it is difficult to get out of bed, making this diagnosis inappropriate. Shortness of breath is a symptom, not a cause of impaired gas exchange, making this nursing diagnosis ineffective. The patient certainly has an imbalance of nutrition, but it is more than body requirements, obesity. What height of the bed is used to transfer and handle the patient safely? 1. Knee level. 2. Hand level. 3. Elbow level. 4. Shoulder level. Answer 3. Elbow level rationale. While transferring and handling a patient, the height of the bed should be at elbow level for the purpose of safety. The nurse is attending to an older adult patient who has sustained a fall and has broken a femur. The nurse explains to the patient that as the body ages, the bones become weak due to osteoporosis and become more prone to fracture. Which statements are true about osteoporosis? Select all that apply. 1. The cause may be hormonal imbalances or insufficient intake of nutrients. 2. There's a structural curvature of the spine associated with vertebral rotation. 3. Osteoporosis is a disorder of aging and results in the reduction of bone density or mass. 4. There is inadequate and delayed mineralization, resulting in compact and spongy bone. 5. The bone remains biochemically normal but has difficulty maintaining integrity and support. Answer 1. The cause may be hormonal imbalances or insufficient intake of nutrients. 2. There's a structural curvature of the spine associated with vertebral rotation. 5. The bone remains biochemically normal but has difficulty maintaining integrity and support. Rationale: in osteoporosis, the bones remain biochemically normal but have reduction in density or mass. The cause of osteoporosis is uncertain, and theories vary from hormonal imbalances to insufficient intake of nutrients. Osteoporosis is common in aging adults. Osteomalacia, not osteoporosis, is an uncommon metabolic disease characterized by inadequate and delayed mineralization, resulting in compact and spongy bones. Scoliosis is a structural curvature of the spine associated with vertebral rotation. When caring for a patient who can assist with positioning, what should the nurse keep in mind? 1. If the center of gravity is higher, the nurse can have more stability. 2. If the base of support is narrower, the nurse can have more stability. 3. If the balancing activity is divided between the arms and legs, there's a reduced risk of back injury. 4. If the nurse's face is towards the direction opposite to movement, this positioning prevents abnormal twisting of the spine. Answer 3. If the balancing activity is divided between the arms and legs, there is a reduced risk of back injury. Rationale. Dividing the balancing activity between the arms and legs reduces the risk of back injury. The lower the center of gravity, the greater the stability of the nurse. The wider the base of support, the greater the stability of the nurse. Facing the direction of movement prevents abnormal twisting of the spine. Which statement is true regarding exercise and activity? 1. There are 4 categories of exercise. 2. Isotonic exercises cause muscle relaxation. 3. Examples of resistive isometric exercise are walking and swimming. 4. Isometric exercises involve tensing muscles without moving body parts. Answer 4. Isometric exercises involve tensing muscles without moving body parts. Rationale. Isometric exercises involve tightening or tensing muscles without moving body parts. There are 3 categories of exercise: isotonic, isometric, and resistive isometric. Isotonic exercises cause muscle contraction and changes in muscle length. Examples of resistive isometric exercises are push-ups and hip lifting. Which actions should the nurse perform during the assessment phase when caring for a patient diagnosed with impaired physical mobility? Select all that apply. 1. Inspect the patient's body alignment, posture, and mobility. 2. Reassess the patient for signs of improved activity and exercise tolerance. 3. Observe the response of the patient's body systems to activity and exercise. 4. Consult and collaborate with members of the healthcare team to increase activity. 5. Ask for the patient's perception of activity and exercise status after interventions. Answer 1. Inspect the patient's body alignment, posture, and mobility. 3. Observe the response of the patient's body systems to activity and exercise. Rationale. Inspecting the patient's body alignment, posture, and mobility and observing how the patient's body systems respond to activity and exercise are parts of the assessment phase of a patient diagnosed with impaired physical mobility. Reassessing the patient for signs of improved activity and exercise tolerance is part of the evaluation phase. Consulting and collaborating with members of the healthcare team to increase activity form a part of the planning phase. Asking for the patient's perception of activity and exercise status after the intervention forms a part of the evaluation phase. A patient is admitted to the hospital with osteoporosis and lower back pain. The patient loses balance when trying to stand and walk. The patient has a nursing diagnosis of body imbalance. What instructions does the nurse give the patient? Select all that apply. 1. Instruct the patient to widen the base of support by separating the feet. 2. Instruct the patient to bring the knees closer together to maintain a broad base. 3. Instruct the patient to lower the center of gravity closer to the base of support. 4. Instruct the patient to keep the center of gravity away from the base of support. 5. Instruct the patient to maintain a vertical line from the center of gravity through the base of support. Answer 1. Instruct the patient to widen the base of support by separating the feet. 3. Instruct the patient to lower the center of gravity closer to the base of support. 5. Instruct the patient to maintain a vertical line from the center of gravity through the base of support. Rationale: to maintain body balance. The patient must attain a posture that requires the least muscular work and places the least strain on muscles, ligaments, and bones. To do this, the patient must first separate the feet to a comfortable distance to widen the base of support. Then the patient must try to increase balance by bringing the center of gravity closer to the base of support. The body posture is adjusted such that the vertical line from the center of gravity falls through the base of support to attain body balance. The knees should not be kept closer. because this can decrease the width of the base of support and impair balance. Increasing the distance between the center of gravity and the base of support would also impair the balance of the patient. Knees should be kept wide. Keeping the center of gravity away from the base of support will result in a loss of balance while standing or walking. Which measure should the nurse adopt to reposition a patient in bed? 1. When pulling a patient up in bed, the bed should be in Trendelenburg's position. 2. For patients with stage 3 or IV pressure ulcers, care should be taken to avoid shearing force. 3. If the patient weighs less than 200 pounds, 91 kilograms, friction-reducing devices should be avoided. 4. If the caregiver needs to lift about 55 pounds, 25 kilograms of a patient's weight, the patient is considered fully dependent. Answer 2. For patients with stage 3 or IV pressure ulcers, care should be taken to avoid shearing force. Rationale: for patients with stage 3 or IV pressure ulcers, care should be taken to avoid shearing forces. When pulling a patient up in bed, the bed should be flat or in a Trendelenburg's position. If the patient weighs less than 200 pounds, 91 kilograms, friction-reducing devices and 2 to 3 caregivers are needed. If the caregiver needs to lift more than 35 pounds, 16 kilograms of a patient's weight, then the patient is considered fully dependent and assistive devices should be used. What should the nurse teach a diabetic patient about exercise? 1. Exercise leads to improved glucose control. 2. You can perform medium to high intensity exercise. 3. The effect of exercise on blood glucose levels often lasts for 10 hours. 4. You can start an exercise routine on your own without any physical examination. Answer 1. Exercise leads to improved glucose control. Rationale: the nurse should teach a diabetic patient that exercise leads to improved glucose control. Diabetic patients should perform low to medium intensity exercise. The effect of exercise on blood glucose lasts for 24 hours, not 10 hours. The nurse should instruct the patient to undergo a complete physical examination before starting any physical exercise routine. A patient with a body mass index (BMI) of 36 has a sedentary job. The patient states that she has never exercised. The patient has been advised to reduce weight. What actions should the nurse advise the patient to do to promote reduction of weight? Select all that apply. 1. Advise her to discuss her diet with a dietitian. 2. Advise her to undergo gastric banding. 3. Advise her to undergo an intensive exercise training program. 4. Advise her to have realistic goals such as losing 4 pounds over 2 weeks. 5. Advise her to resign from her job immediately because it is the cause of her obesity. Answer 1. Advise her to discuss her diet with a dietitian. 4. Advise her to have realistic goals such as losing 4 pounds over 2 weeks. Rationale: a dietitian can help the patient plan a diet for weight reduction. The patient should be advised to set realistic goals for weight reduction. A reduction of 4 pounds over 2 weeks is acceptable. Gastric banding is the surgical procedure used for morbidly obese patients if dietary measures and medications do not help them. Exercise is a healthy way to lose weight, but it should be gradual. A patient who has never exercised should not start with high-intensity exercises. The patient should start with a mild-intensity exercise and gradually increase the intensity. Although her job is one of the reasons for her sedentary lifestyle and weight gain, it is not the only reason. Resigning from the job will not help the patient. What is the normal state of balanced muscle tension? 1. Muscle tension. 2. Isotonic contraction. 3. Isometric contraction. 4. Muscle tone, tonus. Answer 4. Muscle tone, tonus. Rationale. Muscle tone, or tonus, is the normal state of balanced muscle tension. Muscle tension can be in various states. Muscle tone helps maintain functional positions such as sitting or standing without excess muscle fatigue. This tone is maintained through the continual use of muscles. Isotonic dynamic contraction is a combination of concentric and eccentric muscle actions for active movement. Isometric static contraction causes an increase in muscle tension or muscle work but no shortening or active movement of the muscle. Which group of patients is most at risk for severe injuries related to falls? 1. Adolescents. 2. Older adults. 3. Toddlers. 4. Young children. Answer 2. Older adults. Rationale. Some older adults walk more slowly and are less coordinated. They also take smaller steps, keeping their feet closer together, which decreases the base of support. Thus, body balance is unstable, and they are at greater risk for falls and injuries. A patient with a right knee replacement is prescribed no weight bearing on their right leg. You reinforce crutch walking knowing that which crutch gait is most appropriate for this patient. 1. A 2-point gait. 2. A 3-point gait. 3. A 4-point gait. 4. A swing through gait. Answer 2. A 3-point gait. Rationale. The 3-point alternating or 3-point gait requires the patient to bear all of the weight on one foot. In a 3-point gait, the patient bears weight on both crutches and then on the uninvolved leg, repeating the sequence. A patient is discharged after an exacerbation of chronic obstructive pulmonary disease, COPD. She states, "I'm afraid to go to pulmonary rehabilitation." What is your best response? 1. Pulmonary rehabilitation provides a safe environment for monitoring your progress. 2. You have to participate or you will be back in the hospital. 3. Why are you concerned about pulmonary rehabilitation? 4. The staff at our pulmonary rehabilitation facility are professionals and will not cause you any harm. Answer 1. Pulmonary rehabilitation provides a safe environment for monitoring your progress. Rationale. Pulmonary rehabilitation is beneficial in helping patients reach an optimal level of functioning. Some patients are fearful of participating in exercise because of the potential for worsening dyspnea, difficulty breathing. Pulmonary rehabilitation provides a safe environment for monitoring the progress of patients. A patient with a history of coronary heart disease and chronic obstructive pulmonary disease, COPD, has blood pressure of 180/98 of a millimeter Hg and a body mass index BMI of 28. The nurse is educating the patient on the benefits of exercise. Which point regarding exercise does the nurse keep in mind when educating the patient? 1. Exercise increases diastolic blood pressure in hypertensive patients. 2. Exercise aggravates systolic blood pressure in hypertensive patients. 3. Exercise helps in preventing recurrence of coronary heart disease. 4. Exercise can worsen chronic obstructive pulmonary disease. Answer 3. Exercise helps in preventing recurrence of coronary heart disease. Rationale. Physical activity and exercise improve the cardiac function of an individual. Thus, exercise helps in secondary prevention or recurrence of coronary heart disease. It is proven that exercise can improve the health of patients with hypertension and chronic pulmonary disorders by decreasing the diastolic blood pressure as well as systolic blood pressure. Patients with COPD should be supported and encouraged to increase activity and exercise in a safe environment. The progress of patients with COPD should be monitored in pulmonary rehabilitation. A patient wants to know how exercise affects the body. What effects, changes does the nurse list? Select all that apply. 1. Increased joint mobility. 2. Increased cardiac output. 3. Increased resting heart rate. 4. Increased respiratory rate followed by a slower return to resting state. 5. Increased basal metabolic rate. Answer. 1. Increased joint mobility. 2. Increased cardiac output. 5. Increased basal metabolic rate. Rationale. The nurse explains that exercise increases joint mobility, cardiac output, and basal metabolic rate. Exercise decreases the resting heart rate, and while it does increase the respiratory rate, the return to resting state becomes quicker. For what duration should a patient contract the biceps and triceps muscles while performing isometric exercises? Record your answer using a whole number. Blank _ seconds 1, 6 seconds 2, 15 seconds 3, 23 seconds 4, 10 seconds. Answer. 4. 10 seconds. Rationale. When performing isometric exercises of the biceps and triceps, the patient contracts each muscle group for 10 seconds at a time. A patient with paraplegia wants to sit in a chair. The patient's right side is stronger than the left. What does the patient do when trying to sit? 1. Hold one crutch in each hand and bear body weight on the crutches. 2. Hold one crutch in each hand and bear body weight on both the legs and the crutches. 3. Hold both crutches in the left hand and bear body weight on the left side and the crutches. 4. Hold both crutches in the right hand and bear body weight on the right side and the crutches. Answer. 4. Hold both crutches in the right hand and bear body weight on the right side and the crutches. Rationale. In this patient with paraplegia, the right side is stronger than the left side. Thus, while sitting, the patient should hold both of the crutches in the right hand and bear body weight on the right side and the crutches. The stronger side is more capable of holding the body weight while lowering the body to sit, and thus falling would be prevented. The patient should hold the chair with the left arm while sitting. Thus, holding the crutches in each hand would not allow the patient to hold on to the chair and should be avoided. If the patient holds both crutches in the left hand and bears body weight on the left side and the crutches, the patient is very likely to fall. The left side is weaker and would not be able to bear weight while lowering the body for sitting. If a patient with crutches is in a perfect tripod position, what is the distance between the crutches? 1. 15 centimeters. 2. 30 centimeters. 3. 45 centimeters. 4. 60 centimeters. Answer. 2. 30 centimeters. Rationale. A tripod position is formed when the crutches are placed 15 centimeters to the side of each foot. Therefore, the distance between the crutches is 30 centimeters. For a tripod position, 15 centimeters is too close, and 45 centimeters and 60 centimeters are too far. You are transferring a patient who weighs 320 pounds, 145.5 kilograms, from his bed to a chair. The patient has an order for partial weight bearing because of bilateral reconstructive knee surgery. Which is the best technique for transfer? 1. Use a transfer board. 2. Obtain a stand assist device. 3. Implement a 3-person carry. 4. Use the ceiling mounted lift. Answer. 4. Use the ceiling mounted lift. Rationale. The use of patient handling equipment helps prevent injury to healthcare workers and patients. In this situation, The ceiling-mounted lift would be the best choice for transferring this patient. A transfer board is utilized when transferring a patient from a bed to another bed or cart. The stand assist device would be used when getting the patient out of the chair. Manual lifting should be used as a last resort. A 3-person carry could cause injury to the healthcare workers and possibly even the patient. Which statements apply to the proper use of a cane as an assistive device? Select all that apply. 1. For maximum support when walking, the patient places the cane forward 15 to 25 centimeters, 6 to 10 inches, keeping body weight on both legs. The weaker leg is moved forward to the cane so body weight is divided between the cane and the stronger leg. 2. A person's cane length is equal to the distance between the elbow and the floor. 3. Canes provide less support than a walker and are less stable. 4. The patient needs to learn that 2 points of support such as both feet or 1 foot in the cane need to be present at all times. 5. The straight-legged cane is the most common and provides the most support. Answer 1. For maximum support when walking, the patient places the cane forward 15 to 25 centimeters, 6 to 10 inches, keeping body weight on both legs. The weaker leg is moved forward to the cane so body weight is divided between the cane and the stronger leg. 3. Canes provide less support than a walker and are less stable. 4. The patient needs to learn that 2 points of support such as both feet or 1 foot in the cane need to be present at all times. Rationale. A person's cane length is equal to the distance between the greater trochanter and the floor, not the elbow and the floor. For maximum support when walking, the patient places the cane forward 15 to 25 centimeters, 6 to 10 inches, keeping body weight on both legs. Canes provide less support than a walker and are not as stable. The patient needs to learn that 2 points of support, i.e., both feet or 1 foot in the cane, are present at all times. The straight-legged cane is the most common, but the quad cane provides the most support and is used when there is partial or complete leg paralysis or some hemiplegia. The nurse works at an occupational therapy clinic. A patient who is suffering from type 1 diabetes mellitus has recovered from a fractured tibia. The patient wishes to join a regular exercise program. What advice should the nurse give this patient? Select all that apply. 1. Perform high-intensity exercises. 2. Get a physical examination before starting the program. 3. Wear a medical alert bracelet. 4. Carry sugar packets or hard candy. 5. Monitor blood glucose levels before and after exercises. Answer 2. Get a physical examination before starting the program. 3. Wear a medical alert bracelet. 4. Carry sugar packets or hard candy. 5. Monitor blood glucose levels before and after exercises. Rationale. A physical examination before starting the exercise program helps to evaluate potential risks. Wearing a medical alert bracelet informs others about the patient's problem. It is easier for other people to help the patient in case of an emergency such as hypoglycemia. Sugar packets or hard candy help to treat hypoglycemia if it occurs. The blood sugar levels should be monitored before and after exercise to determine the fluctuations. The patient should not engage in high-intensity exercise. Low or moderate-intensity exercises are preferred. Which activities does the nurse delegate to nursing assistive personnel with regard to crutch walking? Select all that apply. 1. Notifying the nurse if the patient reports pain before, during, or after exercise. 2. Notifying nurse of patient complaints of increased fatigue, dizziness, and/or lightheadedness when obtaining and vital signs before and after exercise. 3. Notifying the nurse of vital sign values. 4. Evaluating the patient's ability to use crutches properly. 5. Preparing the patient for exercise by assisting in dressing and putting on shoes. Answer 1. Notifying the nurse if the patient reports pain before, during, or after exercise. 2. Notifying nurse of patient complaints of increased fatigue, dizziness, and/or lightheadedness when obtaining and vital signs before and after exercise. 3. Notifying the nurse of vital sign values. 5. Preparing the patient for exercise by assisting in dressing and putting on shoes. The nurse is starting an exercise program for a patient who is 27 years old. What is the approximate maximum heart rate of this patient during exercise? Record your answer using a whole number. Blank. BPM 1, 193 BPM 2, 178 BPM 3, 202 BPM 4, 211 BPM. Answer 1. 193 BPM. Rationale. The maximum heart rate of a patient during exercise is obtained by subtracting the patient's age from 220. Therefore, 220 minus 27 equals 193 BPM. A patient is learning crutch walking. Before starting to walk, the patient assumes a tripod position, extends the head and neck, straightens the vertebral column, extends the hips, and flexes the knees. What does the nurse tell the patient? Select all that apply. 1. The axilla should bear some weight. 2. The vertebral column is in a correct position. 3. Keep the head and neck in an erect position. 4. Keep the knees extended before advancing the limb. 5. Keep the hips in an extended position while crutch walking. Answer 2. The vertebral column is in a correct position. 3. Keep the head and neck in an erect position. 5. Keep the hips in an extended position while crutch walking. Rationale. When a patient is learning to use crutches for walking, the patient should be informed about the basic crutch stance in the tripod position. This position includes a straight vertebral column, an erect head and neck, and extended hips and flexed knees. This posture is useful for promoting even weight distribution across all the joints of the body. The axilla should not bear any weight while assuming this position. Excessive force on the axilla can cause compression of the brachial plexus and the axillary blood vessels. The knees should be flexed and not extended to start crutch walking. A flexed position of the knee would cause excessive weight-bearing forces to act on the joints. What does the nurse teach a patient about a walker and its proper use? 1. Hold the hand grips on the lower bars of the walker. 2. The walker has 4 widely placed sturdy legs and 2 open sides. 3. Each time you take a step, move the walker forward and take another step. 4. Your elbows should be flexed at about 45 degrees when standing inside the walker. Answer 3. Each time you take a step, move the walker forward and take another step. Rationale. While walking, each time the patient takes a step, the patient should move the walker forward and then take another step. The patient should hold the hand grips on the upper bars of the walker, not on the lower bars. A walker has 4 widely placed sturdy legs and 1 open side. The patient should flex the elbows at about 15 to 30, not 45 degrees when standing inside the walker. What type of diet does the nurse provide a patient who has decreased cardiac output related to a decrease in myocardial contractility? Select all that apply. 1. Low-protein diet. 2. Low-sodium diet. 3. High-fat diet. 4. Low-calorie diet. 5. High-protein diet. Answer 2. Low-sodium diet. 4. Low-calorie diet. 5. High-protein diet. Rationale. During heart failure, exercise intolerance, cardiac output decreases due to decreased cardiac contractility. Therefore, this patient should be provided with a low-sodium, low-calorie, and high-protein diet. Reduced sodium intake would prevent fluid retention in the body and thus decrease the workload on the heart. A low-calorie diet is very important in preventing atherosclerosis, which would further impair cardiac function. A high-protein diet should be advised, because protein in the diet helps to repair the body. A low-protein and high-fat diet is not desirable for the patient. The patient is brought to the emergency department with possible injury to the left shoulder. Which area will the nurse assess to best determine joint mobility? A. The patient's gait. B. The patient's range of motion. C. The patient's ethnic influences. D. The patient's fine motor coordination. Answer B. The patient's range of motion rationale. Assessing range of motion is one assessment technique used to determine the degree of joint mobility and injury to a joint. Gait is the manner or style of walking. It has little bearing on the shoulder damage. Assessing fine motor coordination would be beneficial in helping to assess the patient's ability to perform tasks such as feeding and dressing, but would not help in evaluating the shoulder. Ethnic influences would not have a direct bearing on the amount of mobility in the joint. The nurse is evaluating care of a patient for crutches. Which finding indicates a successful outcome? A. The top of the crutch is 3 to 4 finger widths from the armpit. B. The elbows are slightly flexed at 30 to 35 degrees when the patient is standing. C. The tip of the crutch is 4 to 6 inches anterior to the front of the patient's shoes. D. The position of the hand grips allows the axilla to support the patient's body weight. Answer C. The tip of the crutch is 4 to 6 inches anterior to the front of the patient's shoes. Rationale: when crutches are fitted, the tip of the crutch is 4 to 6 inches anterior to the front of the patient's shoes, and the length of the crutch is 2 to 3 finger widths from the axilla. Position the hand grips so the axillae are not supporting the patient's body weight. Pressure on the axillae increases risk to underlying nerves, which sometimes results in partial paralysis of the arm. Determine correct position of the hand grips with the patient upright. Support and weight by the hand grips with the elbows slightly flexed at 20 to 25 degrees. How are the double adjustable crutch and the axillary crutch similar? 1. Both have hand grips. 2. Both have metal bands. 3. Both are equally common in use. 4. Both have a curved surface at the top. Answer 1. Both have hand grips. Rationale: both the double adjustable crutch and the axillary crutch have a hand grip to support the body. A double adjustable crutch or forearm crutch has a metal band that fits around the patient's forearm. An axillary crutch is more commonly used than a double adjustable crutch. What are the possible effects of exercise in a healthy individual? Select all that apply. 1. Reduced bone loss. 2. Decreased work of breathing. 3. Decreased resting heart rate. 4. Increased blood pressure. 5. Decreased gastric motility. Answer 1. Reduced bone loss. 2. Decreased work of breathing. 3. Decreased resting heart rate. Rationale: exercise affects various body systems in a healthy individual. Some of the effects include reduced bone loss due to mineralization, decreased work of breathing due to better lung expansion, and decreased resting heart rate due to improved cardiac output. Blood pressure usually decreases due to relaxation of the vessel wall, and gastric motility increases, which helps to prevent constipation. The patient who has a severe left leg injury needs to avoid weight bearing on the affected leg. Which crutch gait is appropriate for the patient? 1. 2-point gait. 2. 4-point gait. 3. 3-point gait. 4. Swing through gait. Answer 3. Three-point gait rationale. The three-point gait is appropriate for this patient because in a three-point gait, the patient bears all of the weight on the unaffected foot. In a two-point gait, partial weight is placed on each foot. In a four-point gait, weight is placed on both the legs. In a swing-through gait, weight is placed on the supported legs, which have weight-supporting braces. In a tripod stance, at what distance are crutches placed from the side of each foot? Record your answer using a whole number. 1. 8 centimeters 2. 28 centimeters 3. 15 centimeters 4. 6 centimeters. Answer 3. 15 centimeters rationale. A patient should be informed about the tripod position used during crutch walking. The tripod position is formed when crutches are placed 15 centimeters 6 inches in front of and to the side of each foot. This position provides maximum stability when starting to walk. A patient with a body mass index (BMI) of 36 has a sedentary job. She has been advised to reduce her weight through exercise. To begin an exercise program, she needs to go through 5 steps. Arrange the steps in the appropriate order. 1. Assemble equipment. 2. Get started. 3. Design the fitness program. 4. Monitor progress. 5. Assess fitness level. Answer 5. Assess fitness level. 3. Design the fitness program. 1. Assemble equipment. 2. Get started. 4. Monitor progress. Rationale. A healthcare provider assesses the patient's fitness level, which is used as a basis for the fitness program. Then the fitness program needs to be designed. The exercise equipment should be assembled accordingly. Next, the patient should begin the program. Progress is monitored regularly to determine the effect of the exercise. Fitness is assessed at 6 weeks and then every 3 to 6 months. Which statement, if made by a nurse, is correct? 1. Permanent cartilage is ossified. 2. Ligaments connect bones to cartilage. 3. Cartilage is a vascular supporting connective tissue. 4. The Achilles tendon is the thinnest tendon in the body. Answer 2. Ligaments connect bones to cartilage. Rationale. Ligaments connect bones to cartilage. Permanent cartilage is unossified, except in adults with advanced age and diseases such as osteoarthritis. Cartilage is a non-vascular supporting connective tissue. The Achilles tendon is the thickest tendon in the body. A patient is admitted to the hospital with injury to the knee joint following a fall. The nurse notices an increased mobility of the joint while assessing the range of motion, ROM. What could be the reason for the increased mobility of the knee joint? 1. Arthritis of the joint. 2. Ligament tears in the joint. 3. Contractures of the joint. 4. Fluid collection in the joint. Answer 2. Ligament tears in the joint. Rationale. While assessing the ROM of the patient, if increased mobility is noticed, it indicates that there is a possibility of ligament tears. Arthritis is an inflammation of the joint resulting in decreased mobility and stiffness. Contractures and fluid collection in the joint may decrease joint mobility and cause stiffness. A toddler has awkward posture because of a slight sway back and protruding abdomen. The legs and feet are far apart and the feet are slightly everted. By what age does the child become slimmer, taller, and better balanced? Record your answer using a whole number. Years 1, 3 years old 2, 2 years old 3, 8 years old 4, 6 years old. Answer 1. 3 years old. Rationale. Toddlers usually have a protruding abdomen and a slight sway back. They usually walk with their legs and feet far apart and the feet are slightly everted. The posture changes by the third year, and the child's gait becomes more balanced. The home care nurse is preparing the home for a patient who is discharged to home following a left-sided stroke. The patient is cooperative and can ambulate with a cane, which must be corrected or removed for the patient's safety. Select all that apply. 1. Rubber mat in the walk-in shower. 2. Three-legged stool on wheels in the kitchen. 3. Braided throw rugs in the entry hallway and between the bedroom and bathroom. 4. Night lights in the hallway's bedroom and bathroom. 5. Cordless phone next to the patient's bed. Answer 2. Three-legged stool on wheels in the kitchen. 3. Braided throw rugs in the entry hallway and between the bedroom and bathroom. Rationale. The three-legged stool on wheels and throw rugs are hazards that put the patient at risk for falls. The rubber mat in the shower, night lights, and cordless phone are all safety measures that should be put in place to prevent fall or injury. By planning ahead and collaborating, the home care nurse can provide a safe home environment for the patient after discharge. Which environmental issue is a hindrance to activity and exercise? 1. Hormonal changes and increased osteoclastic activity with increasing age. 2. Worksites reluctant in motivating employees for physical fitness regimens. 3. A patient's decisions to change his or her behavior to include a daily exercise routine. 4. A patient's knowledge, values, and beliefs about exercise in relation to health. Answer 2. Worksites reluctant in motivating employees for physical fitness regimens. Rationale. Activity and exercise promotion, or lack thereof, at worksites is an environmental factor that affects a patient's ability to exercise. Hormonal changes and increased osteoclastic activity with increasing age are developmental factors that affects activity and exercise. A patient's decision to change his or her behavior to include a daily exercise routine and the patient's knowledge, values, and beliefs about exercise in relation to health are behavioral factors that influence activity and exercise. Which statement is true about the different forms of exercise? 1. Isotonic exercises promote osteoclastic activity. 2. Push-ups and hip lifting are examples of isotonic exercises. 3. A patient who is immobilized can perform isometric exercises. 4. Resistive isometric exercises involve tensing muscles without moving body parts. Answer 3. A patient who is immobilized can perform isometric exercises. Rationale. A patient who is immobilized in bed can perform isometric exercises. Isotonic exercises promote osteoblastic activity rather than osteoclastic activity. Push-ups and hip lifting are examples of resistive isometric exercises. Isometric exercises involve tensing muscles without moving body parts. Which activity is least appropriate for an older adult patient's exercise program? 1. Stretching. 2. High-intensity interval training. 3. Agility training. 4. Weight-bearing and other resistance exercises. Answer 2. High-intensity interval training. Rationale. High-intensity interval training is inappropriate for older adult patients. Stretching is ideal for enhancing circulation. Agility training may help prevent falls. Weight-bearing and other resistance exercises help slow bone loss. The nurse works at an occupational therapy clinic. A patient with type 1 diabetes mellitus has recovered from a fractured tibia and is advised to use a cane for walking. When teaching the patient about the use of canes, which information should the nurse include? Select all that apply. 1. Canes are lightweight, easily movable devices made of wood or metal. 2. Canes should be kept on the stronger side of the body. 3. Canes should be of a length equal to the distance between the greater trochanter and the floor. 4. Canes have a metal band and hand grip that are adjusted to fit the patient's height. 5. Canes have a padded curved surface at the top which fits under the axilla. Answer 1. Canes are lightweight, easily movable devices made of wood or metal. 2. Canes should be kept on the stronger side of the body. 3. Canes should be of a length equal to the distance between the greater trochanter and the floor. Rationale: a cane is an assistive device for walking. It is lightweight and easily movable. Most canes are made of wood or metal to provide good support. The length of the cane should be equal to the distance between the greater trochanter of the hip and the floor, and the cane should be kept on the stronger side of the body. The metal band and hand grips are components of crutches. Canes do not have a padded curved surface at the top. It is a component of an axillary crutch. The nurse is assessing a patient whose right leg is injured and uses a modified three-point gait to climb up stairs. The patient stands at the bottom of the stairs and transfers body weight to the crutches. The patient then advances the right leg between the crutches to the stairs, and then shifts weight from the crutches to the left leg. Finally, the patient aligns both of the crutches on the stairs and repeats this sequence. According to the nurse, which step followed by the patient requires correction? 1. Standing at the bottom of the stairs and transferring body weight to the crutches. 2. Advancing the right leg between the crutches to the stairs. 3. Shifting the weight from the crutches to the left leg after advancing the right leg. 4. Aligning both of the crutches on the stairs. Answer 2. Advancing the right leg between the crutches to the stairs. Rationale: while using the modified three-point gait when climbing up the stairs on crutches, the patient should first move the uninjured left limb to the stairs, followed by the injured right limb. This is done so that the body weight is first transferred to the uninjured side. Advancing the right leg first and bearing weight on the limb during transfer would aggravate the injury. The patient should follow the steps in a particular order. These steps include standing at the bottom of the stairs and transferring body weight to the crutches. Then the unaffected leg should be advanced between the crutches to the stairs, followed by shifting weight from the crutches to the unaffected leg. Finally, the patient should align both of the crutches on the stairs. This sequence should be repeated until the patient reaches the top of the stairs. Therefore, the step that is not appropriate in this scenario is advancing the right leg, which is injured. The leg may not be able to support the patient's weight. What group of muscles contract to accomplish the same movement? 1. Skeletal muscles. 2. Synergistic muscles. 3. Anti-gravity muscles. 4. Antagonistic muscles. Answer 2. Synergistic muscles. Rationale: synergistic muscles contract to accomplish the same movement. Skeletal muscles are attached to the skeleton by tendons. Anti-gravity muscles continuously oppose the effect of gravity on the body and permit a person to maintain an upright posture. Antagonistic muscles relax when active mover muscles contract. Answer 3. 200-pound. Rationale: if the patient weighs more than 200 lb, then friction-reducing devices and at least 3 caregivers are needed to handle and position the patient. Which term is used to explain the relationship of one body part to another along a horizontal or vertical line? 1. Friction. 2. Body balance. 3. Body alignment. 4. Coordinated body movement. Answer 3. Body alignment. Rationale: body alignment refers to the relationship of one body part to another along a horizontal or vertical line. Friction is a force that opposes movement. Body balance is a technique in which a relatively low center of gravity is balanced over a wide, stable base of support, and a vertical line falls from the center of gravity through the base of support. Coordinated body movement is a result of weight, center of gravity, and balance. The nurse is caring for a pregnant patient. The nurse understands that the body posture and alignment in a pregnant patient may change. Where does the center of gravity of a pregnant woman shift? 1, to the anterior, 2, to the posterior, 3, to the left lateral side, 4, to the right lateral side. Answer: 1, to the anterior. Rationale: in pregnant women, changes in body posture and alignment occur due to weight gain in the growing fetus. The center of gravity of the body shifts to the anterior. Therefore, a pregnant woman leans backward and may report back pain. The center of gravity does not shift to the posterior or to any lateral side. This might cause abnormal curvature of the spine. The nurse is assessing joint movements in a patient. What happens during the process of flexion at the elbow joint? 1, triceps brachii acts as an antagonistic muscle and contracts. 2, biceps brachii acts as a synergistic muscle and relaxes. 3, triceps brachii acts as a synergistic muscle and contracts. 4, biceps brachii acts as a synergistic muscle and contracts. Answer: 4, biceps brachii acts as a synergistic muscle and contracts. Rationale: during flexion of the elbow joint, the biceps brachii acts as a synergistic muscle and contracts. Contraction of the biceps brings the arm and forearm closer to each other and causes flexion. At the same time, the triceps brachii acts as an antagonistic muscle and relaxes. The biceps brachii relaxes and the triceps brachii contracts during extension of the joint. A patient has paraplegia and wears weight-supporting braces. Which crutch gait pattern should the patient be trained to use during ambulation? 1. A 2-point gait, 2. A 4-point gait, 3. A 3-point gait, 4. A swing through gait. Answer: 4. A swing through gait. Rationale: while using the swing through gait pattern, the patient places the crutches one stride in front and then swings to or through them while they support his or her weight. This gait pattern does not require weight bearing on the legs, therefore, it is the correct gait pattern for the patient. In a 2-point gait pattern, the patient moves a crutch at the same time as the opposing leg that resembles arm motion during normal walking. It requires weight bearing on one leg and may not be possible in paraplegia. A 4-point crutch gait requires weight bearing on both legs. Each leg is moved alternately with each opposing crutch. Therefore, it is not appropriate for this patient. A 3-point gait requires the patient to bear all of the weight on one foot. The affected foot does not touch the ground. This gait pattern may not be suitable for this patient. The nurse is asked to assist an elderly patient with ambulation at 5 p.m. At 5 p.m., the nurse finds that the patient is distressed and is not oriented to time, place, or self. What is the most appropriate step that should be taken by the nurse? 1. Postpone the ambulation to another time. 2. Assist the patient in walking as scheduled. 3. Ask for help from another colleague to ambulate the patient. 4. Remove any obstacles on the floor before the ambulation. Answer: 1. Postpone the ambulation to another time. Rationale: the patient is disoriented and may be at risk of falling if ambulated. Therefore, the nurse should postpone the patient's ambulation to another time when the patient is oriented and stable. This ensures the patient's safety. Assisting the disoriented patient as per the schedule may increase the risk of falling, even if help is received from a colleague and obstacles are removed from the floor. The nurse is performing assessments to measure the cane size for a patient. Which measurement is appropriate in determining the correct size of the cane? 1. The length from the floor to the hip joint. 2. The length from the floor to the iliac crest. 3. The length from the floor to the greater trochanter. 4. The length from the great toe to the lesser trochanter. Answer 3. The length from the floor to the greater trochanter. Rationale: the patient's cane length should be equal to the distance between the greater trochanter and the floor. This provides maximum support while walking. If the length of the cane were equal to the distance from the floor to the hip joint, the cane would be too long and might not support the patient's movements. If the cane length were equal to the distance from the floor to the iliac crest, it would result in a shorter cane. A cane length equal to the distance from the great toe to the lesser trochanter will also result in a shorter cane, which might make the patient unstable while walking. The nurse is assessing a patient who reports joint pain during walking. Which is the most appropriate question to be asked by the nurse to assess the severity of pain in the patient? 1. Which activities trigger your pain? 2. How far do you walk before the pain in your legs begins? 3. What prevents you from exercising 30 minutes each day? 4. Do you experience muscular joint pain during or after exercise? Answer 2. How far do you walk before the pain in your legs begins? Rationale: the nurse should use different questions, including open-ended and closed-ended ones, when assessing a patient. A patient who reports pain should be assessed for severity of the pain, and the most appropriate question to be asked would be, how far do you walk before the pain in your legs begins? If the patient is able to cover only a short distance, then it indicates that the patient's pain is severe. Which activities trigger your pain, and what prevents you from exercising 30 minutes each day are questions that should be asked to gather information about the precipitating factors of pain. Do you experience muscular or joint pain during or after exercise is a question that should be asked while assessing the extent to which the pain acts as a barrier to exercise. A patient has a body mass index (BMI) of 36. Her work requires her to sit all day. The patient has been advised to lose weight. The patient follows an exercise program to lose weight. What are the benefits of a well-designed exercise program? Select all that apply. 1. Increased cardiac output and decreased venous return. 2. Reduced bone loss and improved muscle tone. 3. Decreased gastric motility and increased triglyceride breakdown. 4. Increased effort when breathing and improved alveolar ventilation. 5. Decreased fatigue and improved tolerance to stress. Answer 2. Reduced bone loss and improved muscle tone. 5. Decreased fatigue and improved tolerance to stress. Rationale: exercise decreases demineralization of bones, resulting in reduced bone loss. The muscle tone improves due to regular conditioning of the muscles. Due to increased consumption of oxygen, the patient feels less fatigued and develops increased tolerance to stress. Cardiac output and venous return increase with exercise due to improved circulation. Gastric motility increases and triglycerides are well broken down to be absorbed. The effects of exercise on the respiratory system include improved alveolar ventilation and decreased effort when breathing. A patient reports sweating and shortness of breath while walking. On examination, the patient's respiratory rate is found to be 30 breaths per minute and the oxygen saturation of blood (SpO2) is 83%. What is the most appropriate intervention? 1. Assess the blood pressure. 2. Assess the blood glucose levels. 3. Administer 25% dextrose via an intravenous IV catheter. 4. Administer oxygen at 2 L per minute via the nasal cannula. Answer 4. Administer oxygen at 2 L per minute via the nasal cannula. Rationale: a respiratory rate of 30 breaths per minute and an oxygen saturation of blood of 83% are indicative of decreased gas exchange due to decreased cardiac output. In this case, oxygen should be administered at the rate of 2 L per minute via the nasal cannula. This is done to improve oxygen saturation in the blood. Assessing the blood pressure and blood glucose levels may not relieve shortness of breath. Administering 25% dextrose via an IV catheter helps to reverse hypoglycemia but has no effect on cardiac output. Exercise lowers blood glucose levels. For how long does the effect of exercise last on blood glucose levels? 1. For at least 24 hours. 2. For at least 36 hours. 3. For at least 48 hours. 4. For at least 72 hours. Answer 1. For at least 24 hours. Rationale: it is important for the nurse to know the effects of exercise on glucose levels. Exercise lowers blood glucose levels, and the effects of exercise on blood glucose levels often last for at least 24 hours. The lowered blood glucose levels do not last as long as 36, 48, or 72 hours. Therefore, the patient with high blood glucose should exercise on a daily basis. The nurse is assessing the body alignment and posture of a patient. Which are the indicators of an optimal standing posture? Select all that apply. 1. The knees are in a straight line between the hips and ankles. 2. The head is flexed anteriorly and in midline. 3. The feet are flat on the floor and slightly apart. 4. The spine is straight with normal curvatures. 5. The abdominal muscles are relaxed. Answer 1. The knees are in a straight line between the hips and ankles. 3. The feet are flat on the floor and slightly apart. 4. The spine is straight with normal curvatures. Rationale: when assessing a patient's standing posture, the nurse must ensure that the knees are in a straight line between the hips and ankles and slightly flexed. This position of the knees is required so that the weight-bearing forces are evenly distributed on the surfaces of the joints. The feet should be flat on the floor, pointed directly forward, and slightly apart to maintain a wide base of support. This is required to maintain balance of the body over the limbs. The spine must be straight with normal curvatures. Abnormalities in spinal curvature could cause the weight-bearing forces to damage the vertebrae. The head should be erect in both standing and sitting positions. The abdominal muscles must not be relaxed but should be well tucked. The abdominals form an important part of the core muscles that support the vertebral column.